The island is in the throes of the deadliest COVID-19 wave since the start of the pandemic in 2020. Health officials registered the previous record high in cases in January 2021 with the third wave of the pandemic in the aftermath of the holiday season. However, the period July to August 2021 has seen far worse numbers with over 3,000 cases recorded in just 28 days. The Health Ministry was girding for an anticipated spike in cases following the elections, but the national epidemiologist Dr. François says the infections have exceeded expectations.
We note that with this current wave, it has peaked beyond what we had in earlier this year. For this fourth wave, the highest numbers were reported within the week of August 22nd to 28th, where we recorded 958 cases of COVID-19. And this, of course, has surpassed what we had seen in January, where we recorded 1,110 cases. So we have surpassed by close to 36% in this current wave.
There are two variants of concern on island. Dr. François says although the lab has picked up on a couple of strains, this may not be a true representation of the numbers given the lead time for the receipt of results from CAFRA.
We have recorded 54 of the Alpha and 3 of the Delta. This by no means indicates that these are the numbers in circulation. However, we are challenged in terms of being able to diagnose or be able to serotype in Saint Lucia. And so samples are sent to the Caribbean Public Health Agency, and this is similar throughout the region where most of the islands do not have the capacity to do so. So we are very limited in that, and we are only afforded 10 samples monthly. So we have a selection criteria which we put in place at the lab to be able to, as much as possible, detect cases which appear to be one of the variants.
The Health Ministry has also noted a 1% increase in school-aged children who contracted COVID-19.
We note that 11% of the cases in this current wave are school-aged. And this is very important to us because, as you know, we have delayed the reopening of school, and while we continue to monitor the situation on the ground. We have noted a 1% increase in that age group, and we have noted also some of the islands in the region have recorded an increase in school-age individuals being diagnosed with COVID-19. So it is a situation that we continue to monitor in Saint Lucia. We are not overly alarmed yet, but it is something that we are monitoring to ensure that our children are protected.
As of Tuesday, September 7th, 2021, Saint Lucia had recorded some 9,200 COVID-19 cases. The Castries district had lodged the highest cases with 30%, followed by Babonneau with 19% and Gros-Islet with 10%. However, in terms of the population of the constituencies, Babonneau has been the most adversely affected area, followed by Anse-Lorraine. Joachim Duplessis, HTS News Force.